My name is Paul Schmitt. I'm a Cerebrovascular and Endovascular neurosurgeon at the CHRISTUS Neurosciences Center. I grew up in New Jersey, in North Jersey, a very small town called Allendale, which is in northern Bergen County. So if you're looking at New Jersey, kind of the peak up there, it's really where I grew up. It was a beautiful place, lots of trees, lots of mountains, very different from Corpus. I have two older sisters, a younger brother, and then my parents, so we were a family of 6. I would say professionally, the person who I always think, I hope he approves of what I'm doing is John Jane, who was the program director at the University of Virginia when I started my residency, and he passed away during my 5th year. And he was a neurosurgery legend. He was the chair at UVA for decades. He was the editor-in-chief of the Journal of Neurosurgery. He was kind of one of the gatekeepers of academic neurosurgery. He trained more chairmen in the US than anybody else by leaps and bounds. So I always hope that what I'm doing he would approve of, and he'd be proud, be happy that I was his resident. Academics is very important, so I don't say this to demean academics in any way, but academics, you're studying a grain of sand for years and years, and that's what your life becomes, and you're the expert on that grain of sand, but you're not doing anything to affect the way that it goes around the world. And medicine, you can study and you can be an academic, but you also get to intervene and you get to affect outcomes in a different way. There are not many specialties in medicine where you can instantly see a difference in someone living or dying through a hospitalization. One of the things I loved about neurosurgery was somebody could come in a really horrible state of health, and with a procedure that lasts less than 2 hours, you can see them make this dramatic turnaround. That's certainly not the rule, but it happens a lot. It happens frequently. You get to see that, and you get to share in that turnaround with the patient. You get to share in it with their family, and that was exciting for me. So I need to make sure that my patients understand why I think something does or doesn't need treatment, and make sure that at the end of the day they're comfortable with what the plan of care is. If somebody really doesn't want a treatment, it's not my job to bully them into it. And if somebody really wants a treatment, I think it's feasible, then it's also not my job to withhold it from them. If I think it's going to change their quality of life, having something treated that I might normally recommend observing, I'm going to offer that to them.